All right, Doctor, we're live.
Hey guys. And we're here finishing the night with male facial sculpting. You guys, typically we do filler Friday, but it's actually Tuesday. I almost forgot the day because we've been going non-stop with all these fillers and lasers and surgeries. And we have a male, a good-looking younger male that just wants a little bit of sculpting. We close this because the music's kind of loud. What we're going to do is we're going to use Juvederm products. We're going to use pretty much Voluma for all of his sculpting. This is going to give us the most lift, the most contour to his cheeks, his jawline, his chin, and temples. All the areas that we want to really define in a younger male that wants enhancement of his male features. And then we're going to do a little Volbella. We've done 3 already today on live. Doing Volbella, the softest of the Juvederm fillers, but lasting the longest in the lip area, I find. So let's start from the top down. Let's work on the upper third, and let's go to the temple area. So this area tends to be a weird area for people because they can kind of hear it. Do you hear it?
I do, yeah.
Like I'm going into your brain, but I'm not really going to. So we're going to do a little filler here because this area tends to be an area that guys lose volume quite easily, and it makes them a little more aged, or what we call skeletonized. We don't want that look, especially if you're a fit male or female. I find this in my runners, my yoga patients, fad diets, peptides. You're losing weight on the peptides. You may lose some volume in the temple. So we just use a little filler here on the bone to get a nice little lift. And you can see even a half a syringe on each side really helped give it a little bit of contour there and help lift the area. Then we're going to work our way down to give him some structure. Did we show this on live? Oh, we just showed it on live, doing a horizontal approach to a male cheek. That's what we need to do here. If you do a vertical approach, he may be ready to go to Hamburger Mary's on Sunday. You guys know what that is. So we're not going to do that. We're going to keep him very masculine, and we're going to keep him more horizontal in the midline. So we're going to focus using the Voluma here. Yeah, we're trying to keep him masculine, not feminine. Now, it depends on the look that somebody wants. I had a patient today that does a lot of drag, and he wanted to have a little bit higher of a cheekbone. So, depends on what you're looking for. So what we're doing, if you take a look, and Jordan can show that to you on L angles, that little bit that didn't pass the lateral canthus makes the one side look more lifted, the eyes look better, and also the cheek more contoured from that sort of 90-degree angle. What are they saying?
Right? People are saying, hey, me.
Hey, me.
So people are saying a bunch of random things on here.
Rando. So again, a horizontal approach on bone, using Voluma. Weird feeling, I know. You might feel a little bruised, a little sore tomorrow, but nothing crazy. So again, look at what that little bit just did. It gave him some volume depth.
Someone said, hey, Ken, where's Barbie?
Well, how do you know Ken wants Barbie?
Yeah.
Maybe Ken wants Ken. Just depends on where you are. What you're looking for. I'm not saying that you do, but I'm just saying in general. Let's not make assumptions.
Ken.
We were at a restaurant the other day, and there was only what was it called? All gender bathrooms, and we were confused when we went in, and one of the mothers was in there with her daughter in the all gender bathrooms. I thought we were in the wrong bathroom, but you never know. Oh wow, that made a big difference already.
So say, how do you address the horizontal approach with men with high cheekbones?
Well, that's a really good question because when they already have a higher cheekbone, the mid-face is really low volume, so you really need to focus on what's called a deep medial fat pad and a submalar approach. So what we're doing right now is that's what I'm actually going to do.
Someone can't wait to get their jawline done. Hopefully have a consult with us.
Or a treatment planned. Maybe it's a New York patient.
Do you aspirate in certain areas? Curious about this?
No, talk to me about that. My staff should know. Why don't I aspirate?
Because you know the anatomy.
Yeah, well, that's what I said. I mean, Jordan, that's what I said for 10 years. But I also told people, when people asked me at conferences, I said it doesn't work. And what happened this year, an article came out with all the biggest injectors who've been telling me to aspirate for 10 years that says aspiration doesn't work. So it's not recommended as a preventative treatment protocol. So doing what we do best, small injection doses. So we're going to do a submalar approach, and that will allow us to, again, now on this side is a little more
Do you prefer needle instead of cannula for the cheeks?
Yeah, pretty much. He used to do some cannula. It's a lot more. He has a little more hollowness here. So we're going to blend the submalar approach here in this, what we call submalar triangle. We're gonna give a little volume here up to
When
the
you
corner
injected
of
on the cheek, was it on bone or intradermal?
bone, on the bone. Okay.
That's really good.
His anatomy is more difficult, so we want to make sure that it's right. So again, you don't want him, he's a little more hollow on this side, so we're actually going to go there, turn him in just a little bit. Now, he's very strong back here, but a lot weaker in comparison. He actually would do really good with little Botox on his chin because it would soften the muscle here and allow his chin to come forward. But you guys are going to see a big difference right now with his chin because we're going to build this out with width because that's really what he needs.
Let's know how long does this last?
1 year. Okay. The chin in a male with HA filler can really require a lot. So I'm going to show you guys. Go to the other side. So again, almost treating this like a liquid implant, where right along the area you would actually put a chin implant if you wanted one.
Someone said he's
Already
cute.
take a look at
People are
his
hitting on our patient.
applications are there. Send it to the
Send a
DMs.
DM, it'll probably go to him.
We'll see, we'll see if he accepts or not, and then we'll take your credit card and decide if you're a candidate. So, no, I'm kidding. Lift on up your chin. I want to show them the angle. So he already has a defined jawline angle. Let's make it a little more defined. So he doesn't need too much filler actually because his masseter muscle is actually pretty large, but why not? Guys like a little bit more feature enhancement.
People are saying, what if their credit card declines?
You're denied.
So does the DM.
Denied.
Yeah, denied.
Save up. Okay, so we just did a little definition along the jawline of that side, making it way more crisp because we have some width now. Hold on. Okay, so turn it this way. So we do that same thing on this side. Hold on. Sorry, guys.
People want to know how much pain he's in.
None, actually. It's all good. It's just hearing it going in is a little weird.
It's a crunchy.
Mm-hmm.
So again, giving a little definition all along the jaw. So we
How
can
many
kinda-
syringes for this?
I think we're using 8. How many do we have there?
8.
8 syringes, guys. And that's actually, I want to use more. That's actually a little low.
Yeah.
But you guys will see it's still going to look great. So we pretty much did the sculpting part. We did his jawline, we did his cheek, we did his temples, we did his chin. So pan a little bit so you guys can see all that definition. Now we're going to work on his lips. So again, the goal here is just softening, and we're using Bobella.
When do you come back to New York?
May 12th to 17th, guys. We're already booked, so make sure you get that appointment ASAP. Tell them how to make that appointment.
Guys, send us a DM, full name, email, and phone number. Our call center will reach out to you.
Don't worry, Jordan's shirt that says that is coming.
We'll be here. We'll be here for next trip.
It's gonna be, hi, I'm Jordan. Send me a DM with your name and your mobile phone.
Woo!
I know, lips do hurt a little bit. Guys don't tolerate lips so well.
Feet.
Just hold. So again, the key is not to over accentuate too much Cupid's bow in a male. Just subtle.
Topical numbing cream. Yes, guys, we did use that
It
before.
does hurt though, lips hurt. Let me see from the front. Slide past it. There we go. Ooh, we got a little bit of a...
Do you only have an office in LA? No, guys. New York, LA, and Florida. Is there a quick fix for dark circles under the eyes?
I wish. Yeah. One of our peels and skincare initially, and then come in for
Can we ask this one?
lasers or plasma pens. Sometimes it requires surgery, guys. Sometimes you need a little upper bluff. We got Dr. Sandin over there.
Yes or no?
What are they saying?
Here.
Interesting. Yeah, I think you can ask the question.
All right, guys. They're asking, are BJs different with lips done?
Here's what I always tell people. Here's what I tell people. If you do the BJ immediately after a lip filler, it may be very different and you might bite down on something on mistake. So, because there's numbing inside. So I would recommend waiting a little bit of time before doing that. How do I know? Because a patient of mine did that. Just so you know, and her husband called me because she bit him. Not lying. I've learned everything in my entire career. I would also tell you, do not use Lucy & Co. lip plumper before you're going to give a BJ. So,
That's a fact.
that is a true fact.
Yep.
And if you want to be mean to somebody while they're asleep, you can take Lucy & Co. and put it. We're going to do a BJ.
Also a fact.
So wants to know, where are you located? Guys, New York, LA, and Florida. Send us a
God,
DM.
Those lips.
Looks so good.
That's like when Justin did his lips for the first time with Velour.
Mm-hmm. Oh, what, 3 years ago?
They were like the perfect, remember? Okay, so I feel like he looks like the Superman filter
I think
now.
so.
What?
So we should
We
do
should
it
do it
again.
again.
Yeah, we should.
People hitting on Dr. Emer.
We can't,
Guys,
we're
send us a
We're
DM.
gonna do a male
with your
facial sculpting
application.
teaching next week. Okay, so what do we do now?
We're going to give them a reveal.
And a reveal, we gotta do it.
All right,
Because
here we
he
go.
literally looks like a
Oh,
sculpted
so
superhero. Alright, show him, alright, give him the phone.
Grab the
Grab
phone.
the phone. Take a look at your face. What do you think?
Nice.
Without the voice change.
He's like,
Nice.
What do you think? What were you looking for?
This. I mean, I'm
He's so
very,
good.
I'm very red right now, but yeah, it looks awesome.
So look at the chiseling, look at the angles, right? Look at the definition here. You know what he looks like right now? The guy from, oh my god, what's the show right now that everyone likes on TV with Zendaya?
Euphoria?
His
Yeah.
face, look right here. Look at his face in there.
Jake from Euphoria?
It looks just like him. Look,
Nate
it's
Jacobs.
lifted here.
Yeah, Nate Jacobs.
It's widened here. It's a little sculpted here, so this has more definition. And look at your lips. Zoom in. Show everyone the lips. What do you think
Yeah,
of having?
wow.
Have you ever had your lips done?
No, well, yeah, once when I was like 25, but this looks better.
Great. Well, I'm the best. So that
Yeah,
makes
you're the
sense.
best.
So come in a little closer. Show everyone the lip plump. Now turn a little. Show them the angles because I want everyone to see the angles. Look at the definition here. Look at the lifting there. And even the temples, what do you think? To fill it out here. It just makes
Oh
it
yeah,
look
it makes a
healthier.
huge difference.
Just healthier. So now let's take a
Awesome.
look at the mirror. So give
Looks
that back to
skinnier
Jordan.
too.
What?
Looks skinnier too.
Yeah, slimming. So now what do you think?
Oh yeah, it looks great.
What were you looking to achieve?
Just accentuating the features that are already there, like just a little bit stronger with the cheeks and the jaw. So this is exactly it.
And then what I did was a different technique you guys don't see me do often, where we outline the entire jaw. He has a nice tighter neck, so you can do that. When you look at the angle, take a look from the side, it's more like sliced like a knife. Look like with a knife. Look at that.
Oh yeah, that's a difference for sure.
Yeah, it's for sure. And then it blends into the width of the chin. So that's male facial sculpting, you guys. We're creating the Superman look, or superhero, I don't know what you want to call it, but it's a really great night to the end of the night. and we'll do a quick pan and we'll show you guys and we'll follow up with him in the next few weeks.
Awesome.
It's fun when you can do enough of the filler.
Yeah. That's amazing. It literally looks like Superman.
Perfect. He does look like that guy Nate.
Yeah, he does.
Nate Jacobs.